We want to say good morning to registered nurse, employee health and wellness manager from Maui Health, Chrissy Miller. Good morning, Chrissy.
Good morning. Thank you for having me back.
You know, Chrissy, one thing that we haven't been talking about, or maybe no one's been talking about, is COVID-19. Can you give us an update on the current status of COVID-19 in our community and what the latest variants are?
Yeah, that's a really good question, and you're right.
Yeah.
I don't think too many people have been talking about COVID. And
Yeah.
I don't blame anybody.
Yeah,
but
true.
So with the recent activity, and you can actually go to the State Department of Health website. They actually have a dashboard on there that will tell you the activity of COVID-19. And right now we're actually seeing an increase in COVID in the community, and this is most likely because right now it's June. We just had graduation. A lot of people are getting together for the holidays. People are going on their summer vacation. So that could be why we see an increase in the community. But yeah, I would just encourage people to check out that website if they're interested in what's happening with COVID. But that's the State Department of Health, and they have a nice dashboard on there that you can look at.
I'm sure many people in the community already check out the website. Just at the Ag Fest this past weekend, I seen plenty of people with masks on. Whether it was for the dust there or for COVID reasons, people are still aware, just not talking about it, I guess. Chrissy, how can I tell the difference between a flu, COVID-19, RSV, and just the common cold? How can I tell the difference?
You know, to tell the difference, and as you may already know, but all of them, the flu, RSV, COVID-19, the common cold, their symptoms are all very similar.
Yeah.
So unless you're actually testing for the actual virus, it would be really hard to know like which virus you have. But we know not all cases require, if you're sick, you have upper respiratory symptoms, you don't always need to be tested. So a few clues that you can kind of identify what you have is if you know that somebody else recently was diagnosed and tested and they had COVID, for example, and you were with them and most likely you can narrow it down that you have COVID now, or if you know what's commonly circulating in the community. But what I would recommend is if your symptoms are definitely not improving, you always want to call your doctor. If they're getting worse, you're not improving, that's a good indicator that you want to call your doctor and find out next steps that your doctor may want to do. And then always just remember, just like you said, when you went to the Ag Fest and people were having their mask on, or protecting themselves. But if you are sick, you definitely want to stay home, self-isolate, and not spread it to others would be my recommendation.
For sure. Staying proactive, too. Chrissy, thank you for calling us this morning, and have a wonderful day and into the weekend, all right? We'll talk again.
Aloha. Thank you.
Aloha.